It is my pleasure now to welcome our second speaker, Professor Christina Grupcheva, the former EBO president and the vice rector at the Medical University of Varna, who will discuss the topic how young ophthalmologists can prepare for the subspecialty exams. Thank you. Please, Christina.
Dear colleagues, it's a great pleasure to talk about the subspecialty exams in ophthalmology. I would like to start with a little bit of historical perspective. And I would like to mention that in the past, historically in medicine, we were using a variety of different modalities for teaching and variety of different modalities for examining. And in some countries, there are still practical exams where students and actually young specialists are supposed to do lots of practical things. However, the pandemic of COVID-19 taught us that we can do a lot of those things virtual and save the stress for the doctors and save the stress for the patient as well. So what are the main pillars that we need to follow? Well, on one hand, we have the national specialists and national regulation, but these young specialists today would like to be at the European standards. And also, all of us are having different level of training. So somehow we need to find a way to do it in a way that it's amalgamated in one subspecialty, which is convertible across Europe. That's why the societies here are playing a key role. Also, it is very important where the person that would like to have a recognition in subspecialty practices, because in private and public, in university or just a practice, there are quite a lot of differences. And the main question here is probably who would be responsible? Well, again, societies are playing a key role in this challenge. Why it is challenge? Because you need to have a syllabus, you need to follow certain requirements, you need to be able to monitor your progress, and of course, you need to have a self-control abilities as well. So when we are talking about subspecialty exam, it depends very much on the standards of different societies. And here we need to answer the three important questions: when, who, and how. So who is obviously you? You would like to sit the subspecialty exam. When timing is minimum, so you need to encouple minimum of experience, but then after this, it depends fully on you. And how to sit the exam, you basically need to identify the exam of your interest. What is the role of the EBO? EBO is an organization with 26 years of history today, and it runs comprehensive exams since 1995. And EBO provides the so-called EBO title, Fellow of the European Board of Ophthalmology. But this title is not a must when you decide to do the FEBOS or subspecialty exam. So anyone who completed their studies and who are recognized specialists in ophthalmology in their country can take the exam of FEBOS, which is a subspecialty exam. And in glaucoma, this option is valid since 2015, for cataract surgery 2017, and 2018 for pediatric and strabismus. My colleagues from the European Board of Ophthalmology are working very hard on plans for retina and oculoplasty. And I must say that each society is having their own requirements. So each society decides on the bar that they are setting for the trainees. And also they are deciding on what kind of practice this candidate should have. Also, the different training experiences are considered and the different streams of training. But the most important thing is that the expertise and high standard is required. Therefore, the candidate should not only know the textbooks, they should be familiar with the latest techniques published in the journals. They should be familiar with the latest techniques reported in general. So, who can sit this exam? Somebody who already finished their subspecialty training. In Europe, we do not have fellowships. And this is maybe a little bit of downside, but subspecialty training exists. And my personal recommendation would be that you take a logbook of all your activities. Some societies require surgical experience, some societies do not. But basically, surgical experience and logbook is extremely important. So for MCQs, obviously, you need to look at the published literature because MCQs are made on the basis of the publications, and each MCQ should have a reference in the published literature. In viva voce, you're supposed to demonstrate your comprehensive clinical knowledge on certain case and go deep into the subspecialty. And this comprehensive discussion is for some exams also a must, where a particular problem is put on the table and the jury would like to have your own opinion about this complicated problem. In some, and this is glaucoma and cataract surgery, there is a discussion on published papers. Society may provide or may not provide them. And for surgical experience, societies are having two modalities. One is when they provide you a movie and you have to make comments on different steps. The other one is when you provide your own movie and they stop the movie and make comment on what you provided, and they make a dialogue regarding the surgical technique and your surgical decision at a particular time. So how to prepare recommended readings, of course, is a must. Published peer-reviewed papers for the last 5 years. If there is an opportunity for fellowship, please grab it because this is a very good thing. And again, keep a logbook of what you've done. Self-test knowledge is a good option immediately before the exam. I would recommend if you have, for example, 150 MCQs for your exam or 50 MCQs for your exam, to do 100 times more. So basically to try to do MCQ any day, it is available for you. To monitor your clinical skills and use your colleagues for this as well. Ensure high level of training, not only learning, but also comprehensive training. And of course, if you have access to recognized center, which is outside of your center, it's a nice idea to visit at least one, but maybe even 2 centers and make yourself familiar with something different, something which is not a habit in your own environment. So using different trainers and improve your training and improve your exposure actually will fulfill the criteria and the requirements for the subspecialty. So your optimal performance is based on knowledge, awareness, preparation, and of course, mentorship. My advice will be to stick to your mentor. With this, I would like to wish you success. I hope that many more are going to be interested in sitting the subspecialty exam in Europe. I hope that many more society will be creating new exams and we'll give the challenge to the young ophthalmology. And I wish you a great future success. Thank you very much.
Many thanks, Christina, for clarifying how to prepare for our future exams. And we will have a chance to discuss your presentation at the end of the webinar.